I'm Grant Blashki, I'm a GP, I'm a mental health researcher, and the purpose of this video is to provide some general advice about depression, but we really do recommend if you're going through depression or you know someone who's going through depression that you get them to go along to their GP and get fully assessed and managed properly. The term depression in some ways is a little bit confusing. Because when you think about our everyday language, we often use the term depressed in a very sort of flippant way. It might be that your team just lost the grand final and you say, oh, I'm so depressed, we lost. Or, so it's very hard for people to distinguish between that sort of casual use and real medical depression, which is a very serious illness. The other difficulty is that sadness or grief is just part of being human. And we don't need to put a medical label on that. And so there's not as clear a line in the sand as for some of the other medical illnesses. The other thing is there's a spectrum. So some people will have mild depression, it's sort of a nuisance, or they're having patches of pretty low times. And other people have severe disabling depression that's impacting on every aspect of their life, their work, their family, and the other thing to say is depression can come in small bursts, or it might have been going on for years before someone decides to get help. So as a GP, the typical sorts of things that we see is someone comes in, mainly with a persistent lowered mood. So they're pretty much not enjoying any aspects of their life. And there's a strong sense of hopelessness. And if you read some of the literature of, for hundreds of years, people who've had depressive sort of illnesses, there's a sort of depth of sadness that's way beyond that sort of normal human sadness. So people talk about everything being black, or I'm stuck in a hole, I can't get out. And it's good to know that, because if you're dealing with someone who's depressed, there's a temptation to say, oh, come on, just snap out of it, get out of this. But they can't, and they need some proper help. So I think that's important to understand that. Other common symptoms that people have, sleep problems are very common. Usually a lack of sleep, but sometimes sleeping more. Appetite changes we see. People can drop a lot of weight. Sometimes they put on a lot of weight. And then there are secondary problems. Sometimes people start drinking or using drugs to try and manage the difficulties that they're having. And then I have to say, as a GP, it's a messy diagnosis. Sometimes people come in and they present very well. They're still working, they look terrific, but actually there's sort of a niggling emptiness that's been bothering them, and that doesn't emerge for some time. The other thing that is important to know is some people just have physical symptoms as the initial presentation. So classic things, people will come in with neck pain or back pain, or my stomach's playing up, or I've got a headache. And that's why I think GPs are actually a very appropriate first point of call, because of course we need to make sure that those sort of symptoms aren't a physical disease that we're missing. Another thing to say about depression is it sometimes occurs on its own, but very often it can occur with other illnesses, particularly some of the anxiety problems. And in some cases, people present with depression that's part of what's called a bipolar illness. And bipolar is when your mood goes really high and then really low. And during the high stages, which is sometimes called mania, people can do enormous damage to their life through spending excessive amounts of money or behaving in ways that they would never, new relationships that are inappropriate or unusual for them, and things can get really quite out of control, quite grand beliefs about who they are and what they're doing. So, if there's that sort of element, that's very important to get a specialist involved in that situation as well. The question of why people get depressed is often asked, and people like a simple answer. And in some ways, the story in the community has been, oh, you've got a chemical imbalance. Some of the brain chemicals, which we call neurotransmitters, it's a technical term, are out of balance. It's just like diabetes. It's just with the sugar out of balance. In some ways that's true, and in some ways it's a little bit simplistic because while it's true that we're starting to understand the chemical issues regarding depression, it's usually something that's much more linked in with people's social context and their psychological makeup. And in fact, we haven't really got a full handle on the exact chemistry of the whole thing. So when you think about the biological elements of it, we know it runs in families, so there's definitely an aspect. We know that some illnesses will actually cause depression. And we know that some medications can also cause depression. So that's the sort of biology that must be part of it. But we also know psychology is really important. People's personality, their upbringing, their way of thinking about things is at least as important, and that's something that you can work with with a psychologist or a psychiatrist if there are problems there. The other thing is the social context, and particularly the stresses in people's lives. So a lot of people will have a depressive illness because they've lost their job, or their business has gone down, or they've got divorced, or some other big life stressor. So I think that we need to think about the causes of depression in this sort of nuanced way.